Hey everyone. So in this video, we're going to talk about 3 standing isometric strategies that we can use for knee pain by exploiting the coordinative coupling between the hip and the ankle, okay? And by really exploiting what's called intra-limb compensation to help share load across the lower limb before we concentrate load into the knee. So before we work into the strategies, I want you to imagine a case scenario where we have a client that's as they're moving from the rear foot to the forefoot and progressing through gait from mid stance to late stance, and they're about to push off. Before they push off or before they progress from the mid stance to late stance, they express this very quick tibial extension where the knee begins to extend, okay? And they shift the load into the heel and not into the forefoot. Now, when that load is shifted into the heel, what that will do is it will reduce our ability to plantarflex the ankle to progress forward. And what will also happen is we'll have to distribute that workload more proximally and use more a proximal or trunk leading strategy to progress our body weight forward, okay? But what's also not necessarily talked about is if that tibia is very quick to extend and the load is shifted back into the heel, is this can reflect an inability of the distal quadriceps to be able to manage those forces as that tibia maintains more of a positive shin angle, where the eccentric behavior of the distal quadriceps will be challenged in that position. So if the distal quadriceps in that position are unable to manage those forces, what you'll often see is this very quick knee extension, where the knee will move into more of a closed pack position, where it expresses less variability. Okay, and with less variability, it's less coordinatively challenging for the lower limb to manage forces, but it comes at a cost of adaptability. Okay, but what it really represents for us is a distal quad avoidance strategy. They're avoiding using those distal quadriceps, and as a result, they're avoiding distributing that workload into the plantar flexors as well. Okay, so if we have clients expressing that movement strategy, and they also experience pain through the anterior knee, then one of the key things that we may have to work on during the early, middle, or late phases of rehabilitation, depending on that sensitivity and depending on other limitations that we identify through the objective assessment, we want to try and get some load into the distal quadriceps and restore that low capacity of the distal quadriceps. But if the client is experiencing high levels of discomfort or sensitivity through the anterior knee, then we don't want to concentrate too much load through the anterior knee or the distal quadriceps too quickly or too soon. But what we want to try and do is still try and get some load through the distal quadriceps, but simultaneously distribute a sharing of the workload into other muscular tissues, mainly the hip and the ankle early on. And that will help us distribute some of that workload across the lower limb as a whole, while simultaneously getting some slow exposure of load into the distal quad. And then what we want to try and do as we progress throughout the rehab process is begin to reduce that contribution from the hip and from the ankle and begin to concentrate that load into the distal quadricep. Okay, but it's a process of doing it over the course of a rehabilitation plan. Okay, so one of the things that we need to consider here is how can we manipulate the hip and the ankle to allow for that sharing of workload. Okay, one of the key things that you're going to see here is the use of a hip strategy. When we use a hip strategy, like we'll go through in this video here, all we're trying to do is to allow for the glutes to contribute some of that capacity to manage forces coming up from distal to proximal by expressing more of an eccentric behavior. Okay, what this will do is it will reduce the knee extension demand on the distal quadriceps. But another thing to consider in this strategy here as well is we're using the wall for balance in front, but we're walking the feet backwards. This will allow for a little bit more of a forward angle of the body as a whole, which will allow me to begin with the ankle in more of a dorsiflex position. This will reduce the vertical force production capacity, you can say, or the force production behavior of the distal quadriceps, where we have to produce force upwards. Anytime you're producing force upwards, there's going to be a little bit more contribution from the knee. But when we're producing force forwards, there's going to be a little bit more contribution from the ankle and the hip. When we're producing force backwards, there's going to be a lot more contribution from the quadriceps and the plantar flexors there as well. Okay, so where you're producing force, the directions of where you're producing force will have an influence on the area of where force is distributed through. Okay, so once we walk the feet back, We're going to hover the heel, keep a slight little knee bend. But what we're going to do here now is express more of an anterior tilt of the pelvis, or a flexion of the pelvis, to allow for the glutes to express more eccentric behavior. Okay. Now we're going to flex the pelvis with the spine as a unit though. Okay. So we're not trying to flex the thoracic spine independent of the pelvis. We're flexing the pelvis and the spine as one unit. Okay. So that allows us to concentrate some of that load into the glutes as well. And then we're bringing the opposing leg behind us into more of an extended position. That will allow for that pelvis to stay a little bit more flexed. And all we're doing then is we're keeping that heel hover. We're driving the forefoot into the ground like we're crushing something underneath the metatarsal heads. And we're working towards holding this for 45 to 60 seconds, okay, while keeping these joint angles. So slight knee flexion, where we can still get some load into the distal quads, but again, not too much load too quickly, because we're getting that intra-limb compensation from plantar flexors and from hip extension, okay? Just to show you the setup there again, so we're walking back, ankle is more dorsiflexed, slight little bend of the knee. So we have that forward shin angle, challenge the distal quads, but we're driving the hips behind us via that anterior tilt, or that flexion of the pelvis, to get some eccentric load into the glutes to help manage those forces moving up through the limb. Okay. So that's utilizing a hip strategy. Okay. But then as we progress, we want to reduce the reliance on that hip strategy. Okay. So the setup is going to be different here. So in this video here, you're going to see, you're not going to see that kind of stepping backwards, but we're going to have the feet directly under the hips. And instead of bringing the opposing femur into extension, we're going to bring it into flexion, because what that opposing femur moving to flexion does is it allows that pelvis to extend more, or posteriorly tilt, which reduces the eccentric load contribution from the glutes. So it helps us concentrate more load into the distal quads and into the plantar flexors. And because we don't have that angle forward of the trunk, we're now driving a little bit more vertical force production here. Okay, so we're getting a little bit more load into the distal quads here. And we're again working up to the point where we're holding this for 45 to 60 seconds, still driving down through the metatarsal heads, still keeping that slight heel hover here as well. And then what we want to try and do is reduce that contribution from the plantar flexors, so we can concentrate that load into the distal quads. And all we're going to do here then is not allow for that heel hover. What we're going to do is still allow for that forward shin angle, that tibial flexion, but instead of now driving low through the metatarsal heads, what we're going to try and do is crush the heel into the ground. And typically what you'll feel here after 10, 20 seconds, might take up to 30 seconds, is you'll feel a building of tension through the distal quad. So you'll feel a burning sensation into the distal quadricep. And that's what we're looking for. We're looking to concentrate that load into the distal quadricep and improve the capacity of that distal quadricep to manage those forces. If you still experience knee pain in this position, then we may have to utilize other strategies or target other limitations that we've looked at during the objective assessment or that we have identified. But typically when we work through this progression, utilizing the hip strategy, utilizing plantar flexion with knee extension, it allows us to slowly build and expose the knee to more load, to the point where we've moved from the sharing of workload to now to this concentration of workload into the distal quad. So we're just gradually exposing the knee to more and more load. And we find this a really effective strategy to expose that distal quad to a greater capacity to handle forces. Okay, so again, we need to consider this within the context of a unique client's limitations. It's not going to be a progression that every single client with anterior knee pain will need to express. Some clients may have too much force moving through the distal quads, where we don't want to concentrate load into the distal quads at all. We may want to concentrate more load into the hip or into the plantar flexors or into the hamstring, for example, or into other parts of the lower limb, and change the strategies that the client might be using. We need to look at other kinematic and kinetic representations across the lower limb. How are these segments interacting with each other? And then also how are forces moving through the lower limb as a whole? Again, remember, we're looking at this within the context of that case scenario we described at the beginning, a client that's very quick to extend the tibia, to extend the knee, which would be representative of a distal quad avoidance strategy. So again, we find this a really effective progression to use from an isometric standpoint. We can obviously add more dynamic movement to progress things as well, to progress the coordinative challenge. But again, give this a try and let us know how it goes.